Hello, everybody. Welcome to the today's webinar on provider relief funds, cost reporting, and some new funding opportunities that were just announced yesterday. Exciting news. In all the years I've been working on rural health clinics, I've never seen them. When driving into work this morning, the CBS News was talking about rural health clinics for the first time that I can ever hear of. So that's amazing, the work that you guys have been doing and the resources that are being provided to you through the help and the lobbying of the National Association of Rural Health Clinics and the National Rural Health Association and all the other people that are helping you guys get the resources you need to take care of our patients. So I always want to start off with a thank you to you guys for fighting the good fight, and we just appreciate it very much. My name is Mark Lynn, a CPA from Chattanooga, worked with the Rural Health Clinic program for some 35 years now. There's my contact information if you need to get a hold of me. Danny Gilbert will be behind the scenes for the most part. If you ask questions in the portal there, she will sort of accumulate those for us and ask those at the appropriate time, and hopefully be able to handle some of the technical issues that you have. If you can't download your the slide presentation is over there. Go to webinar. For some reason hates my slide presentations, and I think we have a lot of pictures because I'm sort of like a third grader. I need pictures to help me get through it. And so I think because they're so big, they have issues, but we will post them in the Facebook group, and we will be posting them on ruralhealthclinic.com under the COVID-19 section. So you will be able to get your hands on them, and we will send them out to you. We'll email them. Anybody that signed up for it by tomorrow, we will send these all out to you. Here is our link to what we do. Yeah, I think by now everybody knows what we do, so we're not going to go through that. If you're not a member of the Facebook group, please join that. We have about 2,300 members. It is for all rural health. It's not for just healthcare business specialists. If you've got something of interest to RHCs, you're more than welcome to post that. If you've got webinars or seminars that you're doing that's informational that will help rural health clinics in any way, please feel free to post it there. We have some great people on there that answer questions for us all the time on billing. So people a lot smarter than I am on there helping you guys out. So we appreciate them very much. We are having another webinar next week. I can tell you this one is going to be moved to a different date and time because my daughter told me last night that she's actually moving out of her dorm on May the 13th. That date changed from a different date. I think she was going to move out on the weekend, but now it's on Thursday the 13th. So I have to go help her move out of her dorm from college. So we will be moving that back a little bit from that date. But if you are becoming a rural health clinic and want to get surveyed, this will help you go through getting ready for that survey for you guys. So also, if you're brand new to an RHC and you haven't had any billing training on how to do Medicare billing, I went through this session a couple of months ago, and it is really, really good. It will help you with the basics, even though I've been around rural clinics for 35 years and know enough about billing to be dangerous. This one really helped clarify a lot of stuff. And for $250, it is a really, really good thing for you guys to do. It's very helpful. So I was very pleased with it. Disclaimer, everything, as far as we know, is updated as of today. Like I said, I've been doing this for 35 years. For some reason, my crystal ball in 2020 went bad, and it's never quite recovered. So I've not really had a chance to figure out a lot of the things that I thought would never happen, like rural health clinics being mentioned on the national news first thing this morning. I really wasn't expecting that in my lifetime. So that's fantastic. Like I said before, questions or comments, if you want to put those in the chat or put those in the question bar, Danny will be watching those for us. We're going to have some poll questions. You're going to get a little test on your knowledge of rural health clinics here in a little bit. So we have the 3 poll questions as we go through. And great thing here is we're going to have a speaker for you besides myself at the beginning here. We've got Nathan Baugh. He's been working super hard to do all this stuff. I did this for the last 2 years. his world has been upside down with COVID and all of the things that he's had to do. So Nathan is going to be with us for a little while this morning, as long as he can be here and share his information on really what's happening in DC. There's such exciting news that came out yesterday from the Biden administration about some of the money that's going to be available to rural health clinics to help mitigate the effect of COVID-19. So Nathan will be with us and sort of go through, we'll have him at the beginning of the session here, and then we'll let him go do what he does so well. So there's sort of our agenda for the day. We may not make it through all the cost reporting stuff. We basically have an hour to do this, but that's okay. We can come back and do the cost reporting stuff at another day because I think some of this other stuff is just more important. It just turned out to be very timely. And so what I'm going to do is basically go through a couple of these slides, and I'm going to get it at a landing point because all this information came out pretty much late in the day yesterday. I think I'd already left work by the time I started seeing the emails rolling in, and I didn't really have time to make, pretty tables and pretty pictures and stuff like that. So I did my normal copy and paste, and so I'm going to get to the copy and paste part of it and let Nathan sort of explain what's going to be happening in the near future. First off, President Biden set a goal to administer at least one vaccine dose by July 4th to 70% of Americans. And so that was sort of the impetus for pushing a lot of this money out. Basically, there's $1 billion that was pushed out yesterday to rural providers as a response to COVID-19. Here's the website that you can go to for the press release, and it has the links to that as well. So you definitely want to go through that and look through that information here. Here's just a summary of what was announced. You're going to get basically, it says up to $100,000 for each of the 4,600 RHCs in the country. And so, Nathan, do you want to explain this process here? Because there's a lot of the language. I know you're sort of the mastermind between the RHC COVID-19 testing website and all of that. So this was probably a good place to have you join in and get us on the right track. So Nathan, thank you for making some time for us, and I'll let you talk for a while.
Sure. Thank you, Mark. Thank you for having me here. And yeah, I'm just here to just give an update on some of the latest developments. Did you poll provide up to? Is that from the president's press release?
That was in this, and this was stolen from the National Rural Health Association. Tommy Barnhart sent that to us this morning.
Yeah.
So I wasn't sure about that, if it was up to or 100,000.
No, it's flat. It's flat. Yeah. Everything that they've told us is that it would be $100,000 flat per RHC. Okay. And I know we last May we said 50, and then it turned out to be like $49,461.42. I believe this time they are, trying to help you identify it in your bank statements by giving it a nice even number of 100,000. So this is per RHC. So that's something that they had talked about for a bit. HRSA has talked about for a bit with us, and we were kind of waiting for the official announcement on this. It's very similar to the COVID-19 testing program, but this is not the COVID-19 testing program. That's the key distinction, right? Very similar. Money's going to show up whether you apply for it or not. But this is COVID testing and mitigation fund program, okay? COVID-19 testing and mitigation program. So what that means is that there will be separate terms and conditions for this funding. In theory, and I think it will turn out this way, is that you'll have more areas to allocate this funding towards. There are still some of our principles that will apply again here, primarily that you can only use this funding for expenses that are otherwise not reimbursed. Only use the testing fund or testing program money and the testing and mitigation program money for COVID-19 related expenses that are otherwise not reimbursed. And furthermore, you have to seek reimbursement. You can't just offer free services and not seek reimbursement if the patient has insurance and the insurance covers that service. Okay, so that principle applies to across the board really for all of these different allocations. So that's coming. They will get very upset at me if I give you the timeline exactly. I would just say I'm going to give it in a very broader sense so that I get myself not in trouble. And I'll just say, you know, I guess I don't know when the seasons change. I was going to use a seasonal reference, but when does summer start, Mark?
I don't know.
June,
July,
June 15th?
June 22nd, maybe that's it, June 22nd, somewhere in that range.
22nd.
Yeah.
June 22nd. I would say late spring then, but that's as much as you're going to get from me. Late spring. So that's the $100,000 again. That's going to show up in everyone's bank account. You will have the opportunity to return that, like the testing funds. If you don't want to deal with the administrative burden, you don't think you can allocate $100,000 over the course of the next year to COVID-19 testing and mitigation expenses, there will be an opportunity to return that. You can return that immediately and forget about it and move on with your life if you want to do that. I'm sure there will be a process. I don't know exactly what the process is. I presume it'll be similar to what the process is currently for the testing program. The other option you can do is maybe you can find $100,000 worth of expenses that are otherwise not reimbursed. Maybe you can't, but you can sit on it for a year or however long it will be. I anticipate there will be some more clarity on the timeline coming. And then, return a portion or return money at the time. Is like, hey, we sat on it for a year and we couldn't find a use, so we'll return at that point. So that's kind of what I want to say about that. There are a bunch of other things happening as well, okay? Everything else, rural health clinics will have to apply for, okay? So last year, there's a lot of allocations just showed up. This year, the $100,000 is like that, and it will just show up. Everything else that is going on this summer and into the fall, rural health clinics will have to apply for, okay? So one of the programs that was announced in the same press release is vaccine hesitancy money, a grant for rural health clinics for vaccine hesitancy work. We don't have too much details on that. I think that might be a little bit later down the line. But again, you would have to apply for that in order to receive funds. So that money will not just show up. There is also going to be an effort made by the federal government to do a direct allocation of vaccines to rural health clinics. I know that many of you probably are in a situation where the supply outstrips demand currently, but if you are in a situation where demand outstrips supply and you would like a direct allocation from the federal government, that they will be doing that. They listed this email, which is the first time I saw this email in the press release, rural policy at HRSA.gov. So you certainly should email that. We had been doing sort of a SurveyMonkey survey to, I guess I could say, pre-filter or pre-identify RHCs that may or may not be interested. Thank you, Mark. If you are interested in that, fill out our form. It's very simple. Email that inbox. I'm not sure exactly what the steps will be. You will have to register in the system and you can get direct allocation. I'll just note on that front that we have new cohorts potentially coming online with children being now able to receive the vaccination. I don't know, that's not official yet, but we're expecting that the vaccination efforts will start to extend to adolescents. And then, you know, the future is unclear in terms of boosters and, you know, what we would have to do with boosters. So I don't want to get ahead of ourselves on that, but it might be good to just register, and you don't have to request, but you can just register in case you do find yourself in a situation where you want to request COVID-19 shots because you're doing the booster, or you're doing, you know, adolescent work. So I'll just put that out there as a potential reason to, you know, pay attention, even if you don't think you right now need the supply. So with that, there's a lot going on, and we are doing the best we can to get as many answers as we can out to the community at the appropriate timeline without confusing folks. Mark, do you have the matrix of all the different funds or allocations in this?
I do.
Yeah.
You want to look at that now?
Let's go to that.
Okay.
There's gonna be a bunch more lines in this matrix. Yeah. So there's gonna be more lines in this matrix, right? And it's gonna get more complex. You know, we have a lot of the phase 1, 2, and 3 general distribution from last year, the rural targeted allocation, RHC testing program, which was the 49,500. Now we have RHC testing and mitigation, which is 100,000 per RHC. The other thing that I will note, and I want to flag, Mark has it here on American Rescue Plan funding. This $100,000 per RHC is coming from the American Rescue Plan. But there's another section of the American Rescue Plan that is $8.5 billion for rural providers, that it will be very similar money to the Provider Relief Fund money. That program has not been announced. That program is not what was announced yesterday. And 8.5 billion is more than the billion that they announced yesterday. So there's going to be a big program announced at some point from HHS that is only for rural providers, rural health clinics, plus other rural providers that qualify, and that will be similar to Provider Relief Fund money, and that it can go for lost revenue. So that I just want to be clear that program is still they're gonna have to announce details on that in the future. And what was announced yesterday was not that. What was announced yesterday was from a different piece of the American Rescue Plan that was funding for COVID-19 testing and mitigation. So I'll take up all of Mark's time if I keep going. I don't know if anyone has any quick questions. Mark, do you want me to try to get questions in the chat box now, or?
There were a couple that came in.
Okay.
Yeah, go ahead, Amy.
There were only 2 so far. One was, when will the terms and conditions be released?
Can't say.
Okay. And then another one came in that said, will this include new in 2021 RHCs? So like new RHCs that got in the program in 2021.
Yes, it should. In the previous allocation, you know, we said every RHC, but it wasn't every RHC. Like, the databases are not always fully up to date, and we had to troubleshoot a lot. I mean, not overall, we got most of it out, a good percentage out, but there's going to be 5 to hopefully like 5 or so % where there's a lag in the database, or for whatever reason the information is not correct. So the newer ones are probably going to be potentially more in that category, but certainly they should be eligible. And you know, in the testing program, as people turned money back in, the government turned around and paid people that they missed in their their first round or their second round of funding. So I suspect something similar will go on here. So as long as the information we have is correct, that the government have is correct, it should be okay. One other thing that I forgot to mention, this isn't totally announced yet, but you will need to be registered on rhccovidreporting.com properly in order to get the funding for testing and mitigation. Okay, so you need to have followed essentially the terms and conditions, which says you need a report on rhccovidreporting.com. You need to have followed those conditions in order to make yourself eligible for this next tranche. If you are one of the RHCs that is not properly registered on rhccovidreporting.com, it's not the end of the world. As long as you register, then you will get paid. So even if you're late and finally, as of this month, you finally register, then you will make yourself eligible, and they will. They've told us that they will have the $100,000 to pay you. So they're not just reserving it for people who have registered, they're reserving it for everyone. They will release it once you have properly registered on that site. For the new RHCs that didn't get that first round of funding, you don't have to be registered. So that's one of those nuanced areas. I think that they're sophisticated enough to know, okay, we didn't pay this RHC in round 1. Therefore, we will not hold it against this RHC for not being registered on rhccovidreporting.com, and we'll pay them at the same time everyone else gets paid. But I'm sure there will be hiccups along the way, and I'm sure we will be working with HRSA to try to troubleshoot those.
Yeah, Nathan, I got a question based on that. Is because I've got this question already. Is if they did not receive that 49,000, should they go in and try to register on the COVID-19 website or your website, or should they just, like you said, if they're going to take care of it and get them the money? I think we got a lot of people that are worried that if they're not signed up and registered on there, whether they got the 49,000 or not,
yeah,
that they're going to get the 100 grand.
This is early days.
Yeah.
So I can't say with 100% certainty the logistics of how that will work. I believe that if you didn't get round 1 funding, you wouldn't be expected to be registered on rhccovidreporting.com. However,
Okay.
when you get round 2 funding, testing and mitigation funding, then you certainly would need to register on rhccovidreporting.com. So the logistics of it, we're going to be working that out, and hopefully in a way that's administratively not burdensome for RHCs.
Okay, perfect. Okay, that's good. Dee, do we need more questions on there?
Yeah. We've got one more that talks, they're already receiving COVID vaccines from the state. Should we still register? I'm assuming she means for the vaccine distribution program.
Right, so you have to keep all the programs straight, right? That's like the #1 tip I always give. Make sure your telehealth services, you're talking about the right thing. And then when you talk about COVID relief funding, you have to be very precise with your questions and your terminology. You can register on our site if you think that you would be interested in a direct allocation of COVID vaccine supply. That program is, again, also early days. They have that rural policy at HRSA.gov. I would email that if you are interested in getting a direct supply to your RHC of COVID vaccines. That registration, if you want to call it that, is not to be confused with the RHCcovidreporting.com website, and not to be confused with Provider Relief Fund portal, which we're still waiting on. So I understand it gets complicated quick, but yeah.
Okay. And then a couple, any more questions, Danny, before we move on?
No, sir, that's it for now.
Okay. All right, perfect. A couple of things on here on this little sort of bucket list of things that came out yesterday is for hospital, critical access hospitals or small rural hospitals, they're going to get $230,000 each from this, as well as, and Nathan, correct me if I'm wrong, and you'll also get $100,000 per rural health clinic that you have as well. So is
right.
Is that right? So, and then
I believe so. My only comment that I'll make on this is that I do not anticipate these two buckets being paid at the same time. I could be wrong. I'm gonna give myself the get out of jail free card on this stuff.
Okay.
I'm just giving you my intel at this time is that I think the RHC 100 per will be made first, and then the payment to the hospitals will be made later. But yes, it would be many of the same entities and same banking account information and same tax ID numbers. So that's my sense as of right now. You know, we may or may not be augmenting RHCCOVIDreporting.com to sort of capture the hospital. That is, I don't want to get ahead of my skis. That's certainly not official yet, but we might be asked to do that because many of the tax ID number organizations that we already have registered on RHCCOVIDreporting.com are the exact same tax ID number organizations that will get this hospital funding. It would really, the sort of the Zen chart, if you will, there will be some hospitals that don't own any RHCs that will have never heard of it, and we'd have to cross that bridge when we come to it. But that's my understanding there. But yeah, it's additive. It's not like you know, if you're a hospital, you get 230 and it doesn't matter that you have RHCs. It's additive.
Okay, perfect. So that will be added on top of that. And then this bottom item here, it says here there's $100 million that are available to Rural Health Clinic Confidence. It says here basically you have to apply, but according to this, HRSA will fund. And again, the source on this document is Tommy Barnhart from the National Rural Health Association, which is a great resource. Both of you guys have. NARHC and National Health Association have done amazing jobs on this stuff. So if you're not a member, make sure that you join, because let me tell you, your funds that you've been paying these guys have really paid off in spades this year. But it says HRSA will fund all eligible RHCs that apply. So to me, that doesn't sound like that's going to be something like an FQHC, grant, Section 330 grant that's going to be very, very complicated. Probably a relatively simple application form. And if it's going to basically says you're going to do something to provide this, if it's $100 million and there's 4,600 RHCs that apply, and I would definitely recommend applying. That's about 22 grand per RHC. If you don't apply, you don't get that money. So think about how you can help your community by doing some education and getting some vaccine confidence. I know I took it, and I only grew 3 extra hands and 2 extra heads, so it worked pretty good. No, it actually had no side effects whatsoever. So, and I'm old as the hills. So
yeah, I would just this program, again, I think all your insights there are pretty spot on. HRSA will fund all eligible RHCs that apply. So it's kind of like when you take the SAT, if you sign your name, you get like 600 points automatically. It's kind of like that. If you fill it out properly, you should be good to go. And it's not going to be like too elaborate where they'll pay one RHC significantly more than another RHC because they had a better application or something like that. It'll be a simpler program than that. But I would encourage people to really think about, okay, if you got this money, you can't go speculate on cryptocurrency with it. You have to use it for vaccine confidence initiatives and to overcome vaccine hesitancy in your community. So some of you may want to do that. Some of you may think that the public health department or some other entity is better suited. And so I would just say don't apply for it unless you want to get into the vaccine hesitancy work in your community. So I'll just leave it at that.
Okay. Perfect. Okay, let's go through some of these slides here real quick. There's some stuff at the NARHC that Nathan wrote yesterday. I think we've sort of covered at least those 2 items there. There's some more information on it as well. So I think some of the things that Nathan's already covered with you there. Here was the questions that we got before, and I think you've already answered those. Were certified 2001, did not receive. So you've got that one. We are waiting. I just had a phone call from one of our doctors. He's got 2 RHCs in Alabama that waiting for the inspection. He's got an approved 855A, but he's waiting on the state. Would we qualify for the 100 grand? Probably the answer Nathan's going to give us is we don't know yet. It's going to depend on, there's probably a cutoff date that HHS uses to distribute these funds. And if he gets surveyed before that date and gets a CCN number before that date, they would be eligible. Is that sort of the right answer, Nathan? Or at least I'm headed in the right direction?
I probably missed the key nuance to it. He's RHC that's certified when?
It hasn't been certified yet. They're waiting for the state inspection right now, which could be any day. We're like in that window where we're expecting Alabama to walk through the door any day.
I would say the answer is no for the first round, but as I mentioned earlier, in the last year's testing program, as RHCs returned funding, and there were a lot of, not a lot, but there was a sizable portion of RHCs that returned funding. As the funding gets returned, the newer RHCs are offered, were offered the 49.5 grand. So I anticipate that will happen again here.
Okay. That's all right. I'm gonna let you get Colin with that answer. No, I'm just teasing. So, okay, let's go on here. This is something that you knew as well. COVID-19 Coverage Assistance Fund, basically for providing the vaccine for uninsured patients. There is a fund where they will compensate you for those uninsured patients. That was just announced on 5/3. There's a couple of webinars that you can go to learn how to get that. That's probably sort of like the uninsured testing program where they're going to pay you for uninsured patients based upon probably the Medicare fee schedule. So you'd probably get around $40 or so for giving a vaccine to an uninsured patient. I think that's the Medicare fee schedule there. So Nathan, do you have any comments on this program, or what do you know about it?
Not too many comments other than I recognize that probably this isn't too big of a deal because most of our patients will have COVID coverage. This is really for people who have certain types of health plans like short-term limited duration insurance, and their insurance doesn't cover COVID testing for whatever reason. That kind of slip through the cracks. So I wouldn't anticipate a lot of patients and or revenue coming from this program. But if I'm wrong and you have a ton of people that in your area that have that kind of insurance and that insurance doesn't fully cover COVID, then I would suggest looking at that. If you haven't had any issues, I would suggest potentially just forgetting about this one and focusing on all the other things that you have to focus on.
Yeah, and it's funny, Nathan, because I thought the same thing for like the uninsured coverage for COVID testing. I was like, oh, that won't be a big deal. And I was looking through, they always show you how much money was paid to every time. There's an Excel spreadsheet. And I was looking through it the other day. I saw this Huntsville hospital that had been paid over $4 million for providing uninsured testing through that portal. And I was like, whoa, that's a bunch of money for a hospital in Huntsville, Alabama. So okay, perfect. So that's let's see here. We'll go on here. This one here too, Nathan. If you could help us with this, you worked on this yesterday for our provider-based rural health clinics with the grandfathering.
Yes.
I know I've run into this issue with the upper payment limit with WPS setting the rates at $100. So can you go through this with us real quick so we can sort of be up to date on this?
Sure. This is mostly going to impact you if you were established in 2020, calendar year 2020. Essentially, we had a drafting error in the RHC payment reforms. We got that drafting error fixed on April 14th, but the new upper payment limits took effect on April 1st. So CMS issued instructions to the MACs based on the law at the time. And the MACs got that instruction, which told them to apply an upper payment limit or a cap of $100 to all provider-based RHCs that were established in 2020, which was fixed on April 14th in the law and was not fixed in the instruction to the MACs until yesterday. But now CMS has issued the edited change request. So the MACs know that the upper limit does not apply to those grandfathered in RHCs or provider-based RHCs that were established in 2020, and that they should be properly grandfathered in at their 2020 reimbursement rate plus an adjustment for MEI. So they took a little delay there, and so some people got letters, and it caused some issues there for people who opened in 2020, but it should work itself out now. And that's largely what this is about. It also had another fix that was really important that applies to future years. So we just know that in the updated change request, there was a very slight edit that had a big impact on how the grandfathering cap is going to work going forward. And so we dodged or we avoided a crisis there, or not a crisis, but we avoided an issue there with this due. So I was actually more happy to see that make it in. And I won't even get into that because it'll only confuse folks. But if you got $100 limit and you don't think you should have gotten it because you were established in 2020, you're provider based, you should be grandfathered. This is now all should be fixed.
Yeah, Nathan, my understanding of the revised law was that if you got certified as of 12/31/2020, which we had a bunch of poor Kate Hill, she was doing inspections for us on December the 28th and 29th and missing Christmas and all that sort of stuff, so we could beat that deadline. And then we had some clients that were trying to get in 855As before 12/31/2020, hoping that would qualify them as well. And my understanding is if they did get that submitted, the 855A submitted by 12/31/2020, that they will qualify for the grandfathering. Is that correct?
Correct.
Okay. And
don't press me on the nuances of how the MACs are going to verify that the 855A was submitted. And the language says submitted and received, but that issue gets nuanced. Like we're talking like, is it postmark date or the date it was received? There's some standing law that says postmarked is the one that applies. So I'm not sure on that level of detail how it's going to work out. But yeah, if you got your 855A in by the end of the 2020, you should be grandfathered in as a result of the April change.
Yeah, and then as far as the grandfathering rate goes, we don't know. From my understanding, is we don't know what method they're going to use to do that. Are they going to use your interim rate? Are they going to use your NPR rate? What my understanding is they're going to when in July they usually send out the proposed regulations for the next year's payment rates and all, and within that document they're going to have some type of regulatory language that will tell us what they're going to use. I would assume they would use an NPR cost report is what I would think, but that's,
the hope is that they would do it in the physician fee schedule rule. So that could be a place. It's possible that they might try to do this all via change requests and guidance documents. So it could go either way, but we're looking at the physician fee schedule rule to really solidify how the grandfathering rates should be set and work long term. I understand that many RHCs don't receive a final cost settled rate until well after that cost reporting period ends.
Right. That's
so
right.
What do we? When we get the final rate for 2020 and 2022, do we go back and readjust things? How do we handle that situation? So those are the types of questions that we're hoping that will be answered in the physician fee schedule.
Yeah. I mean, as somebody who's prepared tons and tons of budgeted provider-based RHC cost reports, I would hope they would go back in the NPR and settle those up, because I mean, you can put any number you want in there. And what I normally do is, and this is sort of like telling how sausage is made, I would tell people, what do you feel comfortable in getting? I mean, that national average is $231 a visit. You think you can justify that? And then the max will normally set the rate. If it's something reasonable, they'll set it at it, but it really doesn't have a whole lot to do with what their actual cost is until you get that cost report filed and you see, oh, our cost was really $300 a visit, or it was really $140 a visit. So yeah, if I was on their side, I would want it to be an NPR sort of settlement. So
yeah,
but we'll see. Okay, let me see here. So that was good. That was good that you explained that. And then there's the actual document that came out yesterday, or a little while ago, May the 4th, dated May the 4th. So it came out yesterday for your folks for that. Here is some more language from the American Rescue Plan. Like Nathan said, there's $8.5 billion that's out there for rural health, for healthcare in general. I'm glad to hear that 1 billion that you talked about wasn't a part of that 8.5 billion. That's really good news. That means there's even more money out there. And then there's going to be some type of application that will come up. Here's just RHCs are included as who qualifies for getting this 8.5 billion. And then according to this, you have to justify a need, put some documentation of your expenses and lost revenues, and apply for these funds. Now, as of this moment, I haven't heard of any way to apply for them yet. HHS hasn't put out anything on this at this moment. Is that still the case, Nathan, as far as you know?
Yes.
Okay, perfect. Okay, and we're about to go into reporting. I tell you what, Charles James is here with us from North American. He's the president of the National Association of Rural Health Clinics. Charles, are you around? I know you're self-muted there. You want to unmute and just say a few words, because I always love hearing from you. And he may have stepped out on us here. Are you around, Charles? Okay, he's probably on the phone. Okay, I'll let Charles. I know it seemed like a good time to let Charles give us an update from his standpoint. Let's go ahead and move on to reporting. And then Danny, if you'll open up this question, the polls here. We got a poll question for you. Provider relief funds must be reported by this date. Our first answer is August the 2nd, 2021. B, June the 30th, 2021. C, July 31st, 2021, and D, to be announced, or we still don't know. So, Danny, are we getting any responses on our?
We've got some. We've got about 25% of people voted.
Okay. They tend to stay awake when Nathan talks.
I'm curious on this one. I'm curious to see the results before I poison the well.
Yeah. So yeah, I'm going to keep my mouth shut on this one. So. Okay. What are we up to, Danny?
About 45%, but they've stopped coming in. So you want me to close it out?
Okay, well, let's shut it down and give us the answers.
All right. Yeah, 65% to be announced.
Okay.
And then 22% said June 30th.
Okay. How many percent? 22?
22% said June 30th.
Okay. The correct answer is we still do not know. So 55% of you passed the first part of the test here. So great. Good news for the rest of you guys. We're going to have to, we still do not know. And that's probably not the answer you would have expected, but that's, at this point, that is still the case. I double check every day. My plan is I walk in the office and I Google Provider Relief Funds portal and look to see if it's changed from that date of March 23rd, 2021. And it hasn't changed in the last 90 days or so. Here is the distribution.
So Mark, can I weigh in on that?
Yeah, go ahead.
The June 30th is a published date in regards to the Provider Relief Fund. I don't know, are you aware of that? It's not in terms of reporting, but.
Oh, that's the date they have to be spent by, is June the 30th.
Right. So I think that some might have gotten confused and thought that. Although while June 30th is the published FAQ date, would not be surprised if they move that back.
Yeah.
In terms of the final date to spend the Provider Relief Fund.
Yeah, my understanding was always that you had to spend it by June. I mean, and we got some slides that show this in a second, but we won't worry about the slides. What my understanding, January 15th, that portal opened, and we were supposed to report by February 15th, and that didn't happen. Basically, you could register, but you could not put your expenses or your lost revenues in.
Yeah.
And then the date, like you said, the date published June 30th was you had to either spend your money or you had to account for your lost revenues by that June 30th date. And like you said, that date hasn't changed yet. Now, hopefully, surely it will get extended, because just due to the fact that we haven't got good information. I mean, we had a change of administration that probably had wildly different ideas about how to do what they're doing, which is why it's taking so long to get this out. So okay. All right, and here's the different distributions. Remember the reporting, the RHC distribution, that 103,000 plus that you got on May the 6th. Those expenditures are going to go in this portal whenever it does open up for reporting. And then these general distributions, phase 1, 2, and 3, those will go in there as well. And that portal, whenever you get these new monies, keep up with it separately, because there's going to be separate portals for the American Rescue Plan reporting as well. So these are going to be different. What they call, the word they use is tranche. There'll be different tranches of money that you have. Keep up with that money very well. You need good records, because we don't know what the reporting's like. So just keep up with every detail of your records of where you deposit that money and how you spend it and how you utilize it to reimburse you for lost revenues or reimburse you for expenses that you've used to pay for COVID, hazard pay, or whatever that is. So the other items here, the 49,000, that's the thing that the National Association of Rural Clinics has done a fantastic job on setting up that portal for us and making it very easy for us to report. Every month you report to that portal. If you haven't done that yet, make sure you start. In fact, I got a phone call this morning from somebody who hadn't done that yet, and they've been a rural clinic for a long time. I was like, oh, you get on that portal today and get that set up and start reporting your numbers, because you basically, it's very simple. I mean, you have to report your total number of COVID tests and the number that were positive during that month, and just go through the months and fill and populate that as well. Nathan, do you have anything to say about that? I mean, I want to just compliment you on that, because that was a really, really fantastic job.
we set that up. Not me personally, but we contracted with a guy to create that website, and we try to make it as simple as possible. It could be augmented to serve some of the purposes for the future here, as I've alluded to already, on the 100,000 for that we're going to get, and for RHCs, and then the 230 for hospitals. So it could be augmented and get a little bit more sophisticated, but my goal is to keep it as simple as possible. And I do wear it as a little bit of pride that little NARHC was able to get the portal up and going back in October, and big ol' HHS still can't get the Provider Relief Fund portal open. Now, we're not collecting too crazy of data, but yeah, I like to think that we're better because we're actually up and running, and they're just still under construction after God knows how much money they probably got for that. So anyways, that's I'm being a little prideful there. So the whole goal is to be low administrative burden on RHCCOVIDreporting.com, and we will retain that. But it may get a little more sophisticated now that it's applying potentially to more than one different program.
Okay, yeah, I think well-deserved pride, I must say. And then also, if you're one of the larger RHCs and you're going to get more than $750,000 of these grant funds, you are subject to something called a single audit, and you probably have never been subject to that before. So you do want to talk to your CPA, not me. I am not the CPA to talk to, but talk to the person who does your taxes, or if you're a hospital, talk to somebody who's doing your audits that's there, because it's if you Wifley is a great example of somebody you need to talk to. So talk to Jeff Bromschaber, Jeff Johnson. Those guys can do single audits because they're very complicated, very hard to do, and you have to have specialized people to do that. And Jeff won't be the person to do it, but somebody at Wifley will know how to do those. If you get more than, where it says yes here, if you get more than $750,000 in these funds in 1 year, you're going to have to do that. So, and then there's a table that Nathan did on the different things. We are going to be adding to that table here in the near future, which is a good thing. Again, here I said, do not include your COVID-19 lab tests in the testing funds in the provider relief funds. There is something on the uninsured fund as well. That's one that I talked about where they got the hospital in Huntsville got $4 million from that particular fund on uninsured. So there's some money out there. Here's our timeline here, our 6/30/2021. This is the one we really got to watch for closely, and hopefully Nathan can give us some good information on when hopefully that change. Hopefully that deadline, it's got to change between now and
There's
June
rumors that it will be delayed.
Yeah, it almost has to be. It's just reasonable that it would be. And as of right now, I mean, the deadline is still by 7/31. You should have all of your reporting done at that point. There's a rumor that says that they're just going to make us report through everything as of on July the 31st and just do it in one fell sweep. But they're sort of running out of time to do that as well. So tell you what, too, we're running. I think we've used this time extremely wisely today, getting the questions answered that we need to. I'm at 1:52 Eastern time. Danny, have you seen more questions come in?
There are.
Why don't you just go ahead and try to get these questions while we have Nathan here. Okay. My time is easy to book. We can do the cost reporting thing next week or the week after. We have till August 2nd to do to get your cost reports in. So we still have plenty of time to work on those. I would rather use this time with Nathan to get these questions answered and get people on the right track to getting their money. So okay. Danny, give us your questions.
Yep. Will there be any other reporting besides the number of tests and number of positives for the 49,000?
That's a Nathan question.
For the 49,
yes.
49,000, which is the RHC testing program, no, that reporting is pretty much settled. But there may be additional questions that we add to the site for testing and mitigation.
Okay.
So when you first start, is there a question, Nathan, that says basically how do you use your funds? And you got like a listing of like 7 different ways that you could possibly check each one of those. That's the only additional thing I could think of.
Yeah, I mean, we might sort of build on that, and like I said, I think it's going to get a little bit more complex if indeed we report the mitigation stuff on rhccovidreporting.com. It's going to get a little more complex. I'm brainstorming, quite frankly, useful questions and data to collect. It'll be I can't say, but if you don't, let's say you turn the $100,000 back in, you don't deal with it, then the only thing you would need to continue to report is the testing data and then one multiple choice question that Mark alluded to.
Okay. All right, Danny, next question.
Hey, there's 2 that deal with the American Rescue Plan, the 100,000. If we returned money for the first round of funding, from last year, will we still be eligible to get the second set of funding?
Yeah, we talked about this. Yes, you should be, because this is not just for testing, it's for testing and mitigation. So you might not have needed it for testing, but you may have mitigation activities that you could use it for. Defining and figuring out what mitigation means and entails is a lot of the work that we have sort of in next steps. Certainly the terms and conditions are going to be illuminating on that. And then I'm sure that HRSA will put out an FAQ that will hopefully give folks some useful clarity on what counts as mitigation or not. But the reason you would get this even though you returned the previous cycle is because this is for a wider array of things.
Okay. Then the second one is, since we did not get the 2020 distribution, would we be able to allocate the new 100,000 distribution for both 2020 and 2021 expenses?
Can't answer that yet. The dates at which you can spend the testing program and the dates that you can spend the testing and mitigation program for, this is not the official name, but you can think of it 1.0 and 2.0. They may allow us to overlap. That may cause a problem sort of within the bureaucracy because it's overlapping and it's like, it looks like double paying. So I can't answer that, but maybe not. It might be something like, hey, you have to find an expense that you incurred, you know, June of 21 and beyond, and you cannot look back and use this for something that you purchased in March of 2020. It may be that, it may not be that. I can't say. Sorry.
Okay. These questions kind of are about allowable expenses and calculations of lost revenue. Is the loss?
Go ahead.
What? Is the loss of revenue just patient revenue, or do we have to account that we received PPP and other funds related to COVID?
I'll let Mark handle that.
Yeah, I'll try that. Thanks, Nathan. But the lost revenue calculations, you can use those. Here, let's go in and tell what we did. We can go into our questions here real quick because we do have one on that. Let's see here, our poll questions. Let's find our poll questions here. Let's at least do our poll questions with you guys. Here we go. How can an RHC compute lost revenue when reporting on the HHS portal? Let's try this one first. And Danny, can you open up that poll for us?
Mm-hmm.
Okay, and now I'm gonna figure out how to move my question marks. Okay, actual 2020 net patient service revenues versus actual 2019 net patient revenue. B, answer is actual 2020 net patient service revenue versus compared to a budgeted net patient service revenue that was approved by March 26, 2020. I know every rural health clinic that we had, I'm sure that y'all operate on a budget and you approved it before March 26, 2020 or earlier. Or C, any reasonable method for calculating lost revenue. Or D, all of the above. So those are our four answers there. Danny, how are people doing on their questions?
We got about 35% have voted.
Okay, and what did they say?
And it's all over the board.
It's all over the board. Okay, so give me the percentages. Let's close her down and give us the percentages.
Okay, 49% said all of the above.
Oh, good. That's really good. I was actually shocked that they got that. Okay.
Yep, and then the next highest was 32% with A, 2019 compared to 2020.
Okay, and the right answer is all of the above. You can do any of these three methods here. If you do use any reasonable method of calculating lost revenue, they will look at it a little bit closer, but you can use that when maybe you have different provider numbers from the previous year, or maybe you've added more services and you would have had this growth plane that you went way up, but because of COVID it didn't grow as fast as it should. So you can use that to do that for your lost revenue. Okay, let's do our last poll question because these are so much fun. And I had a lot of slides, didn't I? Here we go. Okay, here we go. Here's for question. How are RHCs paid for COVID-19 vaccine administration? A, do you bill it to Medicare Part B and receive fee for service? C, you bill it to Medicare Part A as an incident 2 type service and stick it on a UB04? Should you C, include it on the cost report like you do for your flu and pneumococcal? And this also includes for Medicare Advantage and replacement plan patients as well for COVID-19. And also D, bill the uninsured portal for reimbursement. Okay, Danny, anybody still awake enough to get answers on that one?
Yep, we got about 40% in.
Okay, and did they all get that one right?
Unfortunately, no. Most of them did. 77% said include on the cost report, like flu and pneumococcal.
Okay, they finally, okay, everybody got the message. We had a hard time getting that to them. Remember Medicare Advantage plans. This is weird. This is not logical. We never have done it this way, so it's a little different than usual. You're gonna have to put your Medicare Advantage and replacement plans on the cost report only for COVID-19, not for flu, not for pneumococcal, not for bad debts, but for COVID-19 only. That's all you're gonna put on there for that.
Yeah.
So, okay, we are at 2:01, so we're over time. So Nathan, I want to thank you for jumping in on extremely short notice and helping us out today. I appreciate it.
Of course, thank you, Mark, and good luck to everyone. And I know that this is there's not a lot of clarity yet on some of these aspects, and I'm sure clarity is coming, and we'll do the best we can to communicate that as we learn more.
Okay, all right. Well, thank you, Nathan. Thank you, Danny. Thank you to everybody for what you guys are doing. We're going to close it down. We'll have the recording for you. We will have the slides for you as well. So thank you all very much. Thank you, Nathan. Bye-bye.
Thanks, guys.
And